On 24th March, the world commemorated the World TB Day. Tuberculosis is the world's top infectious disease killer, claiming 4,500 lives each day. However, since 2000, 54 million lives have been saved and TB deaths have fallen by 1/3. In a bid to end TB, the World Health Organization issued new guidance to improve treatment of TB, especially multi-drug resistant TB. On the sidelines of a review meeting for the National TB and Leprosy Control Program, Assistant Commissioner for Leprosy and TB Division, Dr. STAVIA TURYAHADWE, said Uganda still has a big challenge in fighting TB.
Every year, over 80,000 people get the disease. The system can only find just 60% of them. And those we find and put on treatment, the number that completes the treatment is also worrying. We are just about 70% treatment success. If we are not treating TB, the sensitive TB properly, it means that we are likely to get even a bigger burden of drug-resistant TB. According to our estimates, we expect to get about 1,900 to 2,000 cases every year with drug-resistant TB from the 86,000 that occur per year. So the system is also not able to get the 2,000 with drug-resistant TB.
The World Health Organization is recommending shifting to fully oral regimens to treat people with multi-drug resistant TB. The recommendations are part of a larger package of actions designed to help countries increase the pace of progress to end TB.
Why now WHO is coming up with an oral regimen is because that the treatment of drug-resistant TB for Uganda currently and for other countries in the world has been involving the use of injections. Globally, WHO has looked at this and is trying to see how to improve the treatment but also maintain the quality of the services by making regimens that are safer.
Dr. TURYAHADWE says the current regimens are efficient in treating TB but have severe side effects, which is why the treatment is shifting to an all-oral regimen.
Now this injection, the particular injection we are using, causes someone's hearing ability to reduce or can even cause permanent hearing loss. So that is a public health concern. Going to treat someone to cure them of the disease and you leave them disabled. We are working on that process as a country, but we have a roadmap where we thought by at least July this year, something should be in the country. Some of the components of that regimen are already with us. We are lacking just a few. So once we have updated our guidelines, then we can be able to shift to the oral regimen for our patients.
The heaviest TB burden in the country is carried by communities facing socio-economic challenges, those working and living in high-risk settings, the poorest and marginalized. Dr. TURYAHADWE adds that backing up treatment with active monitoring of drug safety and providing counseling support to help other patients complete their course of treatment is still a challenge.
We are closing the gap. We are moving forward to reaching them. We have introduced new technologies for TB diagnosis, the GeneXpert machine. Previously, we used to use the microscope, but now we have the GeneXpert machine technology in the country. Now, this GeneXpert machine is able to detect TB, so it will be able to get one of the 86,000 individuals with TB, but also will tell us whether that individual has drug-resistant TB in them.
The head of the TB unit at Mulago Hospital, Dr. Susan AKELLO, explains why counseling is important.
They could actually be taking 30 tablets, a whole ladle full, a whole handful of medicines. So such patients need to be supported to take their drugs every day.
She, however, blames inconsistent treatment adherence behavior to factors like religion.
A patient may not take their medicine because they are not aware that the drugs are taken for 6 months. The patient may also not take their drugs because each time I take my medicines, I get nausea, I get vomiting, so side effects of drugs. It is maybe witchcraft or this cough is caused by something else. So those other beliefs may cause the patient not to take their medicine. Sometimes patients will tell us that my pastor told me that I will heal without medicine.
TB is commonly symptomized by a cough that may last for more than 2 weeks. Dr. AKELLO shared some signs and symptoms that may require you to check for TB.
Fever for 2 weeks or more. Usually in the evening, they will have either they're not gaining weight or they are losing weight, and then night sweats, drenching night sweats.
Dr. AKELLO emphasizes the need for vigilance amongst children because pediatric TB can be tricky to notice since the signs and symptoms vary from the common ones.
What we see usually is that the child is not gaining weight, the child is not feeding well, the child is lethargic and weak.
Dr. ACHILES KATAMBA, a senior lecturer at Makerere University School of Public Health, who is conducting research on TB program implementation, says they are evaluating the efficiency of the hub and spoke model from the Ministry of Health in treatment of the disease.
We are trying to compare the Ministry of Health hub and spoke model of diagnosis of TB with a one module which is placed at health center series. And so we want to sort of, once we get evidence that many patients are diagnosed and initiated on treatment in a timely manner, then we shall be able to provide this evidence to the ministry and be able to advocate for scaling up of a one-module gene expert at lower health facilities so that our patients are diagnosed quickly.
MWESIGYE, NTV.
Thank you.